Britain, known for its jokes about bad teeth, is suffering from a shortage of dentists and ranked third in access to dentists among the 22 richest OECD countries in 2021, and I don't mean in the good way. Problems with the government funding system have exacerbated the problem, leaving millions of people unable to access a low-cost dentist on the National Health Service, the NHS. With the cost of private dental treatment prohibitive for many, the crisis has contributed to a sense of unease in Britain, where a treasured national institution like the NHS is in perpetual crisis, with staff on strike and the cost of living soaring. A parliamentary report in July said that in extreme cases, people are pulling their own teeth, something that is happening in the 21st century, you must imagine. And charities warn that without regular access to dentistry, other diseases are being missed as well. I just feel sorry for the people who are in pain in Britain, is something that someone called Park said when she arrived herself in Istanbul to have the tooth pulled and 2 implants inserted, paying just a fifth of the cost, which were given to her by a British private clinic. There are no official statistics on dental tourism from the UK, but interviews with 6 companies in the highly fragmented industry show that UK dental tourism for these companies is either at record highs or growing rapidly. When Marianne Parks, I mentioned earlier, learned the needed intensive dental treatment, she decided it was best to leave her small English village to get her implant in Istanbul. And Parks is one of thousands of Brits seeking dental treatment abroad. They used to travel for cosmetic treatments to get a perfect smile, but now many go for basic dental treatment that they can't get in the UK. It's just a sign of the times. And it's quite a little sad. Park's Tower Dental Clinic in Istanbul has treated more than 500 British patients this year, up from 222, and the company expects a further increase, partly due to the weak lira. Other dental companies operating across Turkey, as well as Hungary and Romania, are also reporting strong demand from the UK. Medical Travel Market, that's a UK-based consultancy, has received over 1,500 inquiries as of mid-November this year. That's an increase of more than 450% compared to 2022. Dental Implants Abroad says it served a record number of Brits in 23 and helped fly hundreds to Romania to receive dental implants. And Dental Departures, which says it is the world's largest dental tourism company, expects booking from the UK to rise by 15% to a record high in 23. And Dent Royal expects 600 British patients to travel to the Turkish coastal city of Izmir in 23. That's 350 more than last year. Eddie Crouch, the chairman of the British Dental Association, told the Reuters news agency that the closure of British clinics during COVID lockdowns had created a huge backlog, and people were no longer going abroad just for cosmetic treatments. Anecdotally, I hear that a lot of patients go abroad just to get general dentistry, he said. And Vedat Etemoglu, who runs the Tower Dental Clinic used by Park, said there was a staggering difference between Turkish and British dental bills when an NHS dentist is not available. In her case, Parks has an NHS dentist, but due to the cost, they only provide implants in rare cases. For example, when a patient has had oral cancer. Implants are usually only available privately and are expensive, that even the NHS website says. A private clinic in Britain charges £5,000 for 2 implants, while in Turkey, Parks had to pay £923 for treatment, including an extraction. The invoice includes the cost of accommodation, and the flight cost less than £200, and there you see the difference. Industry body BDA says the UK system no longer works because of a dental contract introduced by the government in 2006. They say the compensation structure does not differentiate between the complexity of treatments. As a result, many dental practices are operating at a loss, supplementing NHS income with private work, and many are not accepting new NHS customers. Some simply leave the service limiting patient access. "We have a contract that is not fit for purpose," said the BDA's Crouch. "We have a workforce that is leaving in large numbers." He estimates the numbers of those without access to an NHS dentist at 12 million. And Parliament's Health Committee has declared treaty reform to be essential. The government did not comment on the agreement, but said it was making progress and would shortly set out measures to improve access to NHS dentistry. A spokesman said 1.7 million more adults and 800,000 more children were receiving NHS dental care compared to last year. The spokesman also referred to plans announced this year to increase the number of dental training places by 40%. Critics have said that hiring more dentists will accomplish nothing without reforming dental contracting. The impact of the Conservative Party's policies on the NHS has been a subject of much debate recently, with critics arguing that the changes have led to a decline in quality and accessibility of care. While there have been some positive developments, such as improvements in efficiency and increased access to care, there have also been significant negative impacts, including increased workload for staff, longer waiting times, and concerns about a reduced quality of care. The NHS has faced a growing demand for care driven by an aging population and increased obesity rates, and this has led to increased pressure on staff who are working longer hours and taking on more responsibilities. And this has contributed to burnout, stress, and a shortage of qualified staff. Waiting times for non-urgent treatments such as elective surgery and outpatient appointments have increased significantly in recent years. This is due in part to the increased demand for care, but it has also been exacerbated by staffing shortages and a focus on efficiency measures that have led to a reduction in the number of available appointments. There have been concerns that the quality of care has been compromised under the Conservative government's policies. This is partly due to the increased workload for staff, which can lead to errors and misdiagnoses. And additionally, there have been concerns about the use of standardized care pathways, which can limit the ability of doctors to tailor treatments to individual patients' needs. The impact of the Conservative Party's policies on the NHS has been mixed. And some changes have had positive impacts, such as I said, improvements in efficiency and increased access to care. However, there have also been significant negative impacts, including increased workload for staff, longer waiting times, and concerns about reduced quality of care. The future of the NHS remains uncertain, and it will be important to monitor whether the government's recent pledges to increase funding will be enough to address the challenges facing the service. I mean, everybody knows that the situation of the NHS is complex and that there are a variety of factors that have contributed to the challenges it faces, even Brexit. And the Conservative government policies have been one factor, but they also been influenced by other factors, such as an aging population, rising healthcare costs, and technological advancements. So it's not all on the government, but a lot. And if you want to know more, the next video is right here in the end screen. I'll see you there. I'll be back.